Already we starting to understand there's a connection between inner problems also and also to the musculoskeletal problems. And the connective tissue is maybe the balance between the two. Now, going back to the, let's go to the peristaltics of the esophagus. What caused the peristaltics, instead of the signals of the nerves, to contract in a certain manner? Also, the direction is being given by the connective tissue, by the fascia. Okay, so that's another connection. So it means that the fascia touches the inner organs. It doesn't go into the inner organs. It's not the peripheral muscle, but it goes inwards. It's already covering the organs itself. So back to this understanding, this is how now the fascia tissue has three different depths. Okay, it has what is called the superficial, it's just below the skin. Okay, so even when I'm touching my skin like this, and I'm seeing that it's moving slightly, that means that's the connective tissue. If it was contracted, okay, or it had no movement, like in this direction, suddenly I feel this resistance, that means there's resistance in the connective tissue or in that fascia. So when there's resistance, that means that maybe if it's not moving freely, it might cause me a shoulder pain, for example. Okay, because something here is stuck. The fluids that are in the connective tissue, which is hyaluronic acid, has become honey, and it's stuck. And this stuck doesn't give me freedom of motion, and then my shoulder will not move freely. So that's superficial. Another thing is, and it acts like an accordion. When I push down here, I'm actually putting pressure also on the internal parts of the fascia. So you have the subcutaneous fascia, which is like the myofascia, okay, the muscles. And then you have deep fascia, which is also called the visceral fascia. That's the connective tissue that covers the organs. Now, if we go back to how our body, how it functions, our body wants to always protect the internal organs, okay? I can cut off my arm and I can live. But if I take out one of my organs, or I have any problem with one of my internal organs, it's going to cause into the future more problems. So maybe I won't be able to live. I can't live without my heart. I can't live without my kidneys. I can't most probably live without my livers or lungs. So this fascia wants to always cause, if we look at my body as a tent, and my hands and my feet are like the poles of a tent, always wants to make sure that my area in my internal organs, that the muscles there and the organs are contracting and working at an optimal level. So that means that if I have an enlarged spleen, okay, enlarged spleen or enlarged liver, so there's so much connective tissue that has to go into this area and protect. So it has to be all free flow here, so I can move freely, that the organs can sort themselves out in a new manner so they can keep functioning. But it's going to take it from somewhere. There's going to be tension in somewhere. That tension might be on my arm. Okay, if it's my intestines, might be on my shoulder and causing frozen shoulder. Okay, that might be on my foot, and I have lower foot pain. Okay, so it works in that manner. But also it could be that I have tension in my arm here, and now I'm running to the toilet every now and then. Okay, connection between the large intestine and the small and the intestines. Okay, because it's all connected as one unit. So that's that connective tissue. So already now, if fascia is also the TMM channels, that means that working through the TMM channels also allows me to work inwards. And this is why when I'm doing even Twina or any manual therapy, I'm working also in some way on the internal organs. And when I'm asking a patient, for example, do you have, for example, enlarged spleen or enlarged kidneys, or enlarged spleen or liver? And say, yes, my liver is enlarged. And then I start saying, okay, something here in the area is causing the fascia to contract, and then I'm not having motion for my neck, or pain in my internal parts of my the medial parts of my legs, of my thigh. So this is the connection with this fascia and inwards, and that's 3 different levels. Okay. So a lot of times, this is why palpation is important. That's why a lot of times when I work on my patients, I always palpate them. I palpate their channels. Why? Because the Chinese, I believe, The TMM was something they discovered it thousands of years ago. And now only Western medicine is maybe starting to understand this. So and if we go back into Chinese history, before post-diagnosis, they used to do palpation of the channels. And by palpating the channels and seeing that there's some channel is stuck, understanding that if that channel is stuck, and understanding this channel is connected to this organ or this area of the body, and this is why you're having this like digestive problem, okay? So this is why I always palpate also the channels to see if the channels are flowing freely, okay? It can be, suddenly you palpate the channel, suddenly you get stuck. There's no freedom of movement for it, say on the lung channel, okay? So I can say, okay, maybe you're having something with your lungs. Or if we go back to my patient that I spoke about, that I palpated the Tai-Yang of the foot channel, and I saw that the Tai-Yang of the foot was stuck, okay? And I used the YNSA to also release that Tai-Yang channel. And when I worked on that, it released the lower back. But also working on the bladder, I also released tension on the bladder, also by telling her to go to the toilet every now and then, because it also released that tension on the fascia, on the connective tissue, because in the end, that bladder is covered with that connective tissue, or that fascia. So coming now to the fascia layers, okay, the histology, kind of the histology of the fascia, just to understand it. So we have fibrous fibers, okay, we have fibers, okay, then we have hyaluronic acid, again fibers, connective tissue fibers, hyaluronic acid, fibers, hyaluronic acid, and then the organ, okay? What is so important about this hyaluronic acid? The hyaluronic acid is acting as a lubricant. Okay, it's a lubricant. It allows the layers of the fascia. Now, this is times 3, okay? This is times 3. It allows the fascia to glide freely. And if the fascia glides freely, I'm not having tension on the organs or on the muscles nearby, okay? When this fascia, okay, or this hyaluronic acid becomes more like honey, for example, honey gets stuck and the layers start getting stuck, and then you have fibers flowing into that honey and they got getting stuck. And this is a lot of times when you say that your muscles are stuck together, this is what they mean. The fascia there has to be broken up and get the fluid flowing there again. What influences the fluid? The hyaluronic acid, nutrition. If a patient is eating correctly, that will influence actually, the hyaluronic acid, in some ways, saying the chuli. You know, the chuli is the fluid that runs in between the muscles when you're working like in cupping, guasha. And they say you're working on the chuli. The chuli is kind of, it's everywhere. It's in between the muscles. It's sometimes in the extracellular matrix. Okay? So this hyaluronic acid, like I said, what is influencing the hyaluronic acid to keep it as smooth and as a lubricant is nutrition, hydration, and manipulation. So when you manipulate a certain area, you're actually causing more and more hyaluronic acid to become, the honey to become less and less condensed, and then become more and more free, and the area then have the fascia gliding one from each other. If you go to think about yoga, when you're doing yoga, for example, when doing yoga, you're not lengthening your muscles. Very, very difficult. You have to work long times to lengthen your muscles. What you are lengthening is actually that gliding motion. You're allowing muscles to glide one on each other and stretch more and more and more and more without causing a painful response. That is flexicity in the muscles when you're doing yoga or practicing yoga. I'm not speaking about that the joints you've already exerted them and you're already over, like gymnastics, gymnasts that usually overexert their joints and etc. So that's the level of the fascia level, okay? So we're starting to see how the connection goes from inwards, outwards, how it's important, hydration, nutrition. This is why sometimes when you wake up in the morning, you feel that all your muscles are stiff, or maybe when in the elderly, always say that their muscles are tense, and then they start moving. What they do when they move, and they're having more freedom of flowing of the fascia, and the hyaluronic acid starts generating itself. They drink water, they hydrated themselves, and then they have more freedom of movement. So it's very important to tell your patients when they wake up in the morning, please drink water, okay? Because you want more fluid there and to be more flexible. And like I said, it's more like a 3D motion. It's not, we'll come to that, okay? So coming back, what I'm explaining, that's why I like all these angles. If I would, going back to this drawing, you can really understand how this outer matrix of the body, okay, or outer connective tissue, and it's a net and a web, influences the organs. The organs are not a net, okay? But it's just what covers the organs is also a net. That means if you have a stretch in a certain area, for example, just for example, if I'm standing here, okay, and now I have something exerting on the side, tension on the side, okay, on my back. And now I'm trying to raise this shoulder. So of course I'm having difficulty moving my shoulder. Now ask me to move my other shoulder. I'm also having difficulty. You can see in my shirt is stretching also on that side. That's a connective tissue which is stretching. But if I release it, then my arms are raised and I have freedom of motion. Okay? The same if you think about it, if I have all this area, in my area of my hip, or my fascia is very restrained there. Okay? Think about that my whole body is going to be tilting this way, and now I have stretch throughout my right side. This stretch throughout my right side might even cause plantar fasciitis or heel spur, okay? Because I have every tension in that area. So sometimes when I go and work on my heel spur, I'm not going to do anything. I'm just going to be working on the symptom. I have to palpate the channel and see where the problem is. And YNSA allows me to know that there's a problem on that specific channel. And by working on that, I release that and I have more freedom of movement. So our body is always going to work as one unit. And that's what we have to think about. And this is what this image is trying to show you, that no matter where, you have to see where it is caught and in what channel and how to affect it.